Hello, I'm Nick Pearson. I'm the Executive Director of Jacaranda Health. I'm presenting today with my colleague Genia Grider, who will introduce herself in a moment. Jacaranda Health is a maternal health nonprofit that focuses on improving access and quality of care for mothers and babies. Most of our work over the last 10 years has been in East Africa, but what we wanted to talk about today is a program we recently launched in North Carolina called COVID Moms Helpline. In the slides that follow, we'll talk first about where we come from and how we're borrowing from innovations in Kenya. Secondly, about how the COVID Mom platform works and who we're interacting with. And lastly, a few thoughts about what we're learning and opportunities we see for further innovation to improve outcomes and reduce disparities.
Hello, I am Eugenia Grider, the owner of the Center for Women's Health and Maternity Services. I am a perinatal educator, breastfeeding specialist, and doula with over 18 years of maternal child health experience. Welcome.
Jacaranda Health runs several initiatives to improve maternal outcomes in Kenya. For example, we manage our own high-quality, affordable maternity hospital, and we also partner with government health systems to improve intrapartum care through nurse mentorship programs in public hospitals. Our focus is on programs that are evidence-based, have measurable outcomes, and can be sustained and scaled through partnerships. One of our most successful programs is called Prompts. It's a digital health platform that helps mothers connect to care during pregnancy and in the postpartum period, and it already reaches over 200,000 women across Kenya. The Prompts digital health platform provides nudge messages to educate, remind, and increase health-seeking behaviors, like uptake of prenatal and early postpartum care. And it has a free help desk service where moms can ask questions and get vetted answers throughout the pregnancy continuum. Under the hood, there's artificial intelligence that helps triage urgent questions, warn of danger signs, and help us connect moms to facilities faster. The platform also provides feedback to government partners on how women experience care in public facilities, which can help improve respectful care. As you can see, for an extremely low unit cost, we've seen exciting results from this intervention, such as significant increases in prenatal care seeking and uptake of postpartum family planning. So what does Prompts in Kenya have to do with this helpline in the US? I'm based here in North Carolina. My wife is an obstetrician at Duke, and although Jacaranda's roots are as a global organization, our board and team have been concerned about poor outcomes and disparities in maternal health here in the US for a while. I think for this audience I probably don't have to elaborate on those challenges, or for that matter go into detail about this slide about how COVID is impacting maternal health. Back in April, it was clear that many people were struggling to navigate pregnancy during the pandemic. We wanted to contribute to the community's response, and the fastest way was to borrow some of the tech and expertise from our Prompts platform in Kenya. We pulled together a team that Genia will talk about in a moment, set up a website and Facebook page, built a knowledge base with vetted answers and local resources, and connected it to the help desk platform on the back end. We launched the COVID Moms Helpline in May as a free service to anyone in North Carolina. Genia is going to tell us a little more about how the platform works and what we've seen so far.
Here is how it works. Step 1. Text us at 919-301-9979 from any device that has text capabilities or from Facebook Messenger with your questions or concerns related to maternity and COVID-19. Step 2. Next, your COVID-19 pregnancy specialist will respond as promptly as possible between the hours of 8 a.m. and 8 p.m. in your preferred language. In the third step, our specialist will build a rapport and provide the emotional support, education, and resources needed for a healthy mom and healthy baby. COVIDmoms.org pregnancy specialists will cover content in regards to COVID safety for mom and baby and family members, local social services, WIC, housing, substance abuse concerns, maternal and partner mental health resources for postpartum depression or mood and anxiety, perinatal mood and anxiety, employment and insurance, resources for Medicaid, maternity leave and unemployment, and local health system policies in regards to visiting restrictions and modifications of services. We hired a team of experts in the field and passionate volunteers to ensure that we provide our customers with the best care, from doulas to perinatal educators, nurses, midwives, technology support, and marketing. This is what happens behind the scenes. A pregnancy specialist receives a message from a customer. Based on the customer's needs, the pregnancy specialist will seek out the answer in the knowledge base. The pregnancy specialist will also tag the message based on the topic, the urgency of the matter, as well as when to follow up with the customer. As you can see here, one of our moms is concerned about transmission of COVID at 6 months of pregnancy. Another mom at 20 weeks of pregnancy is concerned with mental health and is struggling. Lastly, you'll see that there is another mom who's due in July who is trying to figure out where she will give birth. This information has been placed in our knowledge base to assist our customers with accurate information. Our team of experts created a dynamic knowledge base aligned with evidence-based care and education, along with best practices used in our healthcare facilities here in North Carolina. This platform allows us to reach beyond many barriers to assist expectant and new families right where they are. So who are we helping? In our engagement of over 1,500 expectant parents, we've noticed that about 50% are Spanish-speaking clients. Also that they have very general questions about pregnancy. We do have a broad geographic distribution between urban and rural areas, hoping to increase our rural area awareness. Also, we noticed in our financial questions, there is concern about Medicaid eligibility, as well as WIC and other pregnancy social services. Because of this, we are partnering with North Carolina Department of Health and Human Services to make referrals directly to county caseworkers in hopes to assist these parents better. Here are a few examples of conversations. A mom that's 6 months living in a hotel in Raleigh, North Carolina is seeking shelter. Another mom is 6 weeks pregnant and needs to find prenatal care and doesn't know how to apply for health insurance. Another mom is concerned about basic needs, how she will provide for this baby. Another mom is experiencing domestic violence, which we know is on the rise. And lastly, you'll see another mom is pregnant and is just fearful about what to expect during the pandemic in regards to care and support.
As Genia mentioned, we tag and categorize conversations to understand what people need help with. Here's a breakdown of topic frequency. You can see a broad distribution of issues through the pregnancy continuum. A lot of questions about financial challenges, where to go for prenatal care, and basic needs like food and housing, but also general questions around pregnancy, childbirth, and COVID. We see a common thread of anxiety, and we also see a lot of people who need help figuring out whether they're eligible for social services like Medicaid, unemployment, and WIC. The majority are women in their 20s, and interestingly, we see a lot of people messaging in very early in their pregnancy, before any formal contact with the health system. This is a bilingual service, by the way, and connection and navigation of care questions seem to be especially common in the 50% of the conversations that are in Spanish. This map of the state provides a breakdown of where people are messaging in from. The majority are from the Triangle and Charlotte, as you would expect, but there's a decent number from rural areas and also from the east and west of the state. That's a snapshot of what we're seeing so far. So what's next? We're going to continue this work in North Carolina over the coming months. The need is certainly not going away. And meanwhile, our team is working to improve resources and referral links. For example, we're working with DHHS to refer people who need more significant care coordination into their high-risk pregnancy program. Secondly, we're also planning to broaden our reach by exploring partnerships with other states and cities. This is obviously only one tool in the toolkit, but we've seen some interest from organizations with existing CHW, doula, or promotora networks to establish digital helplines and reach a broader population. On the next slide, we'll share an example of a partnership we just launched in New York City. Finally, we are really interested in deepening the continuity of services to provide more value to parents and improve pregnancy outcomes. For example, we're hoping to test out early pregnancy teleconsultation and risk screening, virtual group education, better triage of urgent cases, rolling out AI and analytics, and definitely more touch points with patients during the pregnancy. I want to end with an exciting example of broadening the reach of this platform through partnership. We've been working with a group of amazing organizations in New York who are passionate about birth equity. Every Mother Counts, Ancient Song Doula Services, and Village Birth International. They have a great network of doulas, and they wanted to set up a text helpline to reach more women and parents across the city. So we partnered with them to leverage our back-end technology and knowledge base to help set them up. The initiative is called Just Birth Space, and it just launched last week. Finally, we wanted to thank the team at the Maternal Health Learning and Innovation Center for setting this symposium up. We really appreciate the chance to share our work, and we're always interested in connecting and trading experiences. So feel free to reach out to us. We'd love to chat.